Hello, my name is Hilmi Lockman. I'm representing Lung Cancer Network Malaysia. I would like to welcome everyone for today's podcast. Okay, I have another guest today, and that's Pui Hwa next to me. I'm very glad and very happy to have her with us today as part of our World Cancer Day series. Okay, so I'd like Pui Hwa to just introduce herself.
Right, thank you, Dr. Hilmi, for having me here today. My name is Ng Pui Hwa. I've been practicing physio for a good 6 years in a private hospital so far. So I've been dealing with a lot of cases in hospital generally, including cancer patients as well.
Okay. How now? When we talk about physiotherapy, so how did you get into being a physiotherapist? Is this something that I'm in school and I want to be a physiotherapist when I grow up?
Oh no. It wasn't actually my first choice actually to begin with. So what started off was because my grandfather had a stroke. So back then I was actually thinking like, what can I actually do to help out and all, because back then I was actually helping my grandmother, with his food and taking care of him and what. So I was thinking, okay, probably I want to get into a field that can sort of help him out, and I found out physio. So but then physio back then was only available for science stream student, and I'm actually from art stream.
Oh.
Yeah, so I was, it was quite a challenge lah, So I tried going in and then I got accepted and then, and then I was like, okay, let's just give it a try, If it works, it works. If it doesn't, then, So somehow or other, I managed to pull through it throughout the whole, 6 years, and here I am right now.
So there you go. So if you're an art stream student, you want to become a physiotherapist, it's not impossible. So
yes, everything is possible.
Okay, wonderful. Was it something that your impression when you went into physiotherapy, is it the same as when you started working, or is it something totally different?
I think it's a totally different aspect from where I see things, because from physio I always think that all you want to do is help patients to get better, but of course you do not see the other side where the patient was actually struggling to actually get out from their bed or even walk to the toilet to do their daily activities. So these are the things that I never really expected. So for cancer patients especially, they are much more depressed, they are much more do not want to go out and socialize anymore. So when I see this from this kind of aspect, what I see whereby the patients actually, they get very demotivated. So that gets me demotivated as well, because it's all, in the aura, you see. So when you see patients get so demotivated, you feel like, oh no, like what should I do to actually help them to get back up on their feet. But in the other hand, it gives me more motivation to actually help patients like that to get back on their feet, so that they can actually carry out their daily activities as per normal. So people won't see them as, you as a cancer patient, you can't do this, you have to be in a certain way, or a certain skeptical mindset at how people think they were.
Okay. No, I know there's different aspects to, physiotherapy, and when you're trying to, when we are trying to refer patients to you anyway. But in terms of what you do, what can you share from different aspects of their problem? Really, in terms of mobility is one, obviously breathing problems and other things.
Correct. So of course, first and foremost, we would definitely want to address their pain management as well. So because cancer patient, it could be either their post-chemo effect or probably due to their current cancer diagnosis that causes a lot of pain. So we would address them by giving them probably manual therapies or therapeutic exercises, or there are also modalities that we can actually prescribe to actually ease their pain. So this is definitely one of the first thing that we probably want to look into. And second, which is the mobility exercises that Dr. Hilmi has mentioned, because mobility function is very, very important, like I said, because some patients, they will feel like, I'm a cancer patient anyway, I can't do this, might as well I just, So for to get them back to their feet is very important. So getting them to start off with some mobility exercises on the bed gives them more motivation to get them out from the bed and to start walking, you see. So this also helps them to actually increase their muscle strength, their mobility, their coordination, and foremost, And we will also look into aspect where breathing and also respiratory function as well, because patients sometimes they could be really weak, and with all the ongoing cancer treatments, whatnot, can definitely affect their respiratory system. So which would also have an effect of the, what do you call that, mucus retention, which is phlegm. So it's hard for them to actually remove that on themselves if they do not have the energy or the proper technique to do so. So for us, our goal is to actually guide them what are the proper way of doing so, and also some breathing exercises to aid all this mucus to be removed out from their lungs, so they can have better breathing techniques.
Do you use any breathing apparatus or something just to help them to remove their secretions?
Of course, so we do provide chest physios, and we do use modalities as like spirometers or flutter machines like that. So that will actually help them to actually open up their airway even more, so that more oxygen intake is going to go in, where it's going to loosen up the mucus. It will be easier for them to actually throw out their phlegm.
Okay.
Yes.
Now, you touched upon pain management.
Yes.
Okay, earlier part. So what could you do, I mean, in terms of pain management? Because I mean, I'm sure a lot of people out there say, what can physios do to try to get the pain under control?
Yes. So for pain management, we have to see from aspect where is the patient bed-bound. So let's just say if the patient is bed-bound, mostly it's joint stiffness that we're looking at. So from our aspect, from physio, what do? Is we can do some passive movements to actually ease the stiffness, you know, and at the same time we can get them to do exercises with us together. So the more movements they do, actually, that will reduce the stiffness, and at the same time it increases the muscle power as well. So that we are basically one stone kill two birds sort of, you know. For other modalities that we touch about is whereby we can actually do some you know, hot pack or either ice pack. These are the things, but of course we want to look into the patient's problems or patient's diagnosis first before applying all of this treatment, because sometimes it could be very contradicting. So if the patient is not probably, you know, not spread, I mean the cancer cells aren't spreading, so we can probably look into probably TENS machine, ultrasound machine. Yeah, so these are the modalities we can actually look into.
Okay, wonderful. We know that some patients, obviously, with cancer, lung cancer, obviously, with the moment we talk about lung cancer, we talk about smoking. Okay, when we talk about smoking, chronic smokers, then we talk about COPD.
Yes.
Okay, so almost goes sometimes hand in hand with COPD patients. They got lung cancer and they tend to get worse and things like that. So, would you say that if somebody's got COPD and with lung cancer, you might do something like almost like a pulmonary rehab type session for them?
Of course, but the first thing that probably we want to look into is the breathing techniques to see whether are they breathing in correctly, or are they using their accessory muscles to even help them. So with all these accessory muscles, which means it's improper breathing technique, probably therefore that's the reason that why they couldn't get proper air intake in, or probably the right way to actually remove their secretion retention.
How active do you get their family members to be involved in the physio session? Because obviously physios, you're not going to be there all the time. So when the patient goes home, then they're going to be with their family members.
Yes.
Yeah.
Of course, to get to involve family members in the exercises program will be definitely encouraging for the patient as well, because sometimes we do not want the patient to feel left out. You know, I'm a cancer patient, I'm doing this all by myself. So to get their family members or their close friends even to participate in these exercises would definitely give them the extra I would say, to make sure that, oh, I want to do this, I want to get better. Yeah, so it's definitely a good thing to have them to, you know, join abroad with the exercises program and all.
Do you run any, I mean, do you know of anywhere that runs like a group session?
Oh, we do. We can actually do that. So group therapy and all, I think it's very essential as well, because so that the patient doesn't feel left out, thinking that they've been doing all this alone. So they can actually share their experiences, you know, with other patients as well. Same with all the cancer patients, so that they can actually feel sort of connected to share their experience and also what to do, what not to do. So this kind of group activities, we can definitely do it if there is, the same category patients that I would say. Yeah.
Okay, I mean that's great. So cancer patients, one thing, okay, you're quite right in saying that, okay, at the very start, I mean, they are very demotivated and all.
Definitely.
So I do agree, you probably get demotivated as well.
Yes, so that was
it.
my first impression.
Yes. What kind of tricks do you do and try to encourage them?
So for patients like that, I mean, it's definitely a challenge to actually get through, their mental health, I would say, because, it's all very depressing and whatnot. So firstly, I would definitely tell them the benefits of exercises to get them to understand that why is it so important for us to start doing exercises, especially early mobilization. So we can provide them with probably evidence-based practice so that they would actually think that, oh, this thing actually really works. Yeah, I want to try out. So that is one of the tricks that I usually start off with. And then second, we will also look into probably what else? Yeah, we will also look into like family support. That's what we were mentioning just earlier. Yeah, to get the family to actually participate in the exercises as well. And definitely positive reinforcement. So a lot of positive reinforcement is needed throughout the whole exercises. So, they say small steps takes a long way, isn't it? So for them to actually acknowledge, hey, I managed to do things like that, by myself, that will give them the motivation to even progress further. So of course, when we talk about progression, we will look into also a lot of functional abilities. They can actually do it independently. So this is our goal, isn't it? So small achievement to acknowledge all of this progression, so that they are aware that, hey, I'm not just cancer patient, I can actually do this on my own. So to get them on their feet, I think it's something that we want to really focus on. And also probably a lot of stories shared from other patients as well, like group activities you were mentioning, isn't it? So for them to actually get people's opinions or probably shared stories, like what have them gone through and things, I think that will also motivate them to actually want to work harder.
Okay, physiotherapy, well, to me, I suppose before I knew a bit more, okay, when it comes to mindset, okay, you have to be in hospital, either by the bedside or go to the gym. Now, is it all true, or is there other things that you can, does it have to be confined in the confined spaces or in the hospital, or can you do it elsewhere?
Oh no, actually. So nowadays, physiotherapists, they are very they're expanded in all different variations, whereby some physios, they are even opening their own Pilates center where they actually does like, or probably yoga, but they actually incorporate rehab exercises along the way. Yeah, so I think this kind of ideas will get more attraction from other customers nowadays, whereby people will be thinking, like you mentioned, physio is just hospital centers and what is very stagnant, isn't it? But for now, I think a lot of people are much more innovative and brave to try to combine different aspects like yoga and rehab, Pilates and rehab. Yeah, so I think it's actually a very wide genre in terms like how physio can actually work their way out.
Okay, I think that's great. I mean, trying to get people to do a bit more variety of stuff. I mean, it doesn't get to be too boring, so it cannot be monotonous.
Definitely.
You cannot then encourage people to do other things. Do you put on music when you're doing your physio sessions?
This is very subjective. You see, if the patient is actually, vibing along, then, you can actually put it on. But some patients, sometimes they're, a little bit more stressed out.
Yes.
They want to have their own peace. So usually we don't talk much. If when you start out treatment well and the patient starts being chatty and whatnot, then this is where you want to start, going into the whole mental health being to get the patient to understand that why physio is so important, why are we doing this, you need to get better and things. So from this kind of conversation, the patient will be, have that kind of mindset that, oh yeah, actually this is right, so they want to actually progress better.
Okay, great. Okay, I think that's very, very encouraging, very lively session today that we've had. There's something to think about. Again, it doesn't have to be in the confines of a hospital-based area. People do it outside now, okay, in different centers. So those are the options that's available. Okay, is there anything else that you'd like to add? We heard otherwise?
No, I guess we had enough today.
Okay, great. So again, thank you very much for attending the session that we've got with Pui Hwa, physiotherapist. Something to think about. By all means, get seen to or get referred to a physiotherapist. If you know somebody who might need encouragement, might need a bit of motivation, might need the rehab, trying to help control their breathing, pain management, mobility. I mean, again, it's not all purely about mobility. There's other things that they can do, definitely. Okay, wonderful. Thank you again, and thank you for tuning in for Lung Cancer Network podcast. And thanks again for our guest today.
Thank you for having me, Dr. Hilmi.